Welcome to Pivotal People. Today's interview is with Robb, the Managing Director of Impact Health Partners. Good morning, Martin.
Good morning.
Lovely to see you, and thank you so much for joining us at Pivotal People. What is Pivotal People about? It's about people like you who work with us in the care industry, I believe, and who have joined us from a very different route. What you do in the care industry is really important. You know, without what you do, we couldn't do what we do, looking after people. So can I take you right back to the beginning, and when you first got in as a chartered surveyor, right at the beginning, and what you did and what took you on that route. So, would you mind telling us the story?
Well, the short answer is it was a total fluke.
Oh.
So I'd been working in Australia for a couple of years, and I came back and I needed a job. So I networked away and eventually found myself talking to somebody who, first of all, tried to get me to do City of London office rent reviews. And I thought, that sounds like the most boring job in history, with apologies to anybody listening who is a City of London rent review specialist. But he was creating a healthcare property advisory team. And it was him and his mate, and he said, I need half a person. So if you're interested, go and have a think. But if you did take it on, you'd have to fill in elsewhere in the business just to pay your way. And I remember going home on the underground thinking, that industry is never going away. I have no real understanding what's in it. It sounds like it could be a lot of fun and perhaps a little less competitive than mainstream real estate. And that was in 1997.
Okay, so have you found it is less competitive?
Not anymore.
No.
It was a really good, well-kept secret for about 15 years. And then probably around 15 years ago, it started to get a bit more competitive. And now it's almost mainstream, but not quite.
Okay. So what do you enjoy about working in healthcare?
What's kept me in it has been people and seeing people who deliver high quality care, which is an awful lot more useful than the day-to-day stuff that I do. And I really admire that. And also, you think you're having a bad day trying to figure out some real estate problems, but the industry helps keep you grounded and with perspective on what really matters. And that's why I've enjoyed it.
Yeah, I'm totally with you on that. It is the most wonderful place to spend your career.
Yeah.
So from that, joining that company.
Yes.
So what was the next step?
The team grew quite quickly. Back in the late 90s, there was really only one investor called Nursing Home Properties, and then the business that we were primarily advising was grandly named the Quercus Healthcare Property Partnership, which was a joint venture between one of the pension funds and a real estate developer investor. That was a really good time for us. We got in literally at property number 3. Wow. And eventually when that was sold, many years later, the fund was about 250 odd properties. So we had fun learning how to invest in healthcare. We didn't always get it right. But we got lucky with the right clients at the right time. So that kept me going for a few years. And then a business called Christie & Co. approached me for some reason, thinking I could help sort of grow their sort of larger portfolio work streams. And I got stuck there working with Mr. Lunn for 14 years in the end, which was good fun.
Yeah. I'm sure.
Yeah.
I think with the people that are invested in care homes now are very diverse.
Yes.
I mean, we do some due diligence. We don't do the commercial stuff that happens here, but we do the operational due diligence.
Yeah.
And I think we're seeing the type of people involved in care homes coming in from abroad. They may be people that have no care experience whatsoever. Have you noticed the same sort of people investing that are coming in from totally different?
Yes, I mean the UK market has become global effectively in terms of the sources of capital, and ultimately at its simplest level all we're doing is using a class of real estate as a sort of pseudo financial instrument, and how does that actually work, and how does the rent get paid? Those are the most straightforward components. But over time, we've seen more and more American money coming in, Canadian money more recently. There's money from the Far East, there's interest in the Middle East, there's continental Europe has looked at mainland UK, etc. So yes, I've seen it sort of expand and expand and expand.
Is that because we do it better?
I don't know if we do it better necessarily. I mean, I think we do it slightly differently. If you, for example, compare and contrast with the North American elderly care market, or Australia and New Zealand, for example, they've got more of a bias towards independent living rather than the sort of registered care that we have. For whatever reason, we've grown up in that direction. But really, the market only came into existence in the early 80s with the Registered Care Act, if my memory is correct. And so I think some of those markets had gone in a slightly different direction before we then went down that route. Yeah. But it's fine. It's where we are.
So and going forward, how do you see the future of care developing, social care and healthcare? How do you see the future?
Yes, I mean, it's been a perennial question forever, hasn't it? That interaction between social care and healthcare is an unresolved question. Ultimately, again, at its simplest level, there is population growth, there will be population growth, and that increase in the elderly proportion will require more care. So we see at the moment a trend in the direction of higher acuity, and we don't see that going away anytime soon. COVID had one of many indicators that social care can and should help the NHS retain capacity, but I think we're some way away from that being a seamless solution yet.
Yeah, we've been talking about that for pretty much my whole career, and certainly yours.
Yes.
So, it's probably not going to happen. Okay. One of the changes lately is in CQC and how they are not how they're regulating us, but how they are delivering their inspection framework. And I know that you do due diligence. Have you had any has that affected the way that you do your due diligence? Because I know people can be sitting on a requires improvement for 4 or 5 years.
Yes, or an inadequate with an embargo, as one of our properties is at the moment. The local authority want the beds. They've been in very recently, but they are deferring to CQC, so we're waiting for them to revisit. And I think with the transition to their new system, we could be still waiting for quite some time. Yeah. That's a little bit frustrating all round, but it's unfortunate it's not something new, is it? I think the interesting thing for me, and another aspect of what's kept me going in the sector, is that dynamic between what I do, which is essentially bricks and mortar related, but actually the more important part of the business is delivery of care. And then how does the delivery of care interact with the real estate? I mean, I support strong regulation. I have no issue with that whatsoever, but it does need to be a functional process. And it feels at the moment that it's not quite as smooth as perhaps it could be. I have huge sympathy for regulators though, because if they do their job, all they do is do their job. If they get their job wrong, they really get some flack for it, which is hard.
That's very true. So talk a little bit about the buildings, the buildings that you're actually looking after. One of the things that we find are issues are Wi-Fi. Care home Wi-Fi can be a huge problem. How we manage that, I don't know. There's lots of little nooks and crannies. Access lifts that only fit one person in standing up.
Yeah.
And I'm talking about the older stock that I know you don't necessarily get involved in, but how do you make sure that the buildings you use are fit for purpose?
Yeah, that is a really good question. And actually we do have some older stock, and we look at acquiring stock that is older, but on the proviso that we have a day one agreed action plan as to what can be done with the building and how we pay for it and what we start with and what we finish with and when we think we've got it right. We've had a case study where we've taken a first generation purpose built, we've improved the specification of the building throughout, we've upgraded a load of stuff in it, and we've done that at materially less than the cost of a new build.
Okay.
Got the energy efficiency of the building up from awful to, I think we're going to get an A. If it's not an A, it'll be a really strong EPCP. So we know we can do it. The business is trading fantastically. The rent is affordable. The tenant's happy. We're happy. Everybody seems to be happy.
Yeah.
So our next challenge is, having got the case study to work, how do we industrialise that process? Because new builds, and bless them, there's undoubtedly a need for new builds, but they're expensive and they're relatively slow.
Yeah.
And if you factor in the time to get a planning permission, they're really slow.
Yeah.
So I think it's a broad market. There's a space for all of us to try to do our bit. Wi-Fi, it's funny you should ask me about that. I've just come across somebody who's been involved in rolling that out across quite a large portfolio. And I was hoping to see him this morning, actually, but it's going to be next week, because I'm going to ask, how do you do it?
Yes, absolutely.
Because we need to know.
We do. I mean, digital transformation in care homes is going to make such a difference.
Yes.
The AI technology, the monitoring technology that we're putting in is going to need a good infrastructure.
And there's a virtuous circle with the new single framework assessment process
absolutely.
As well. So data is data. But yes, it is a live topic for us as to how does the building infrastructure support the carers? And actually, in a single sentence, that encapsulates everything we try to do. Dodgy lifts, yes. We've seen a few of those. Lift hoist rooms built next to the boiler room with no adequate ventilation. That's not helpful, because they overheat.
Kitchen's too small, laundry's too small. It goes on.
We've all seen them, haven't we?
Oh, yes.
Sadly.
Yes.
Yeah. And that's, to be fair, that's hopefully where new builds have an advantage with those operational efficiencies. The older buildings, you may be just having to face practical realities and then try to solve them as best you can.
Yeah. Lovely. That's been really interesting to talk to you, Martin, and thank you so much for joining us today.
You're very welcome.